Okay, so today we want to talk about the rotational release. In many cases, what you may notice if you're looking at your little toe, or maybe even your big toe, the toe may not lay straight. It may not lay flat. Like my toes here obviously are lying flat. There's no rotation going on. But in some cases, the toe may actually be on its side like this. So the nail, instead of pointing up towards you, it's pointing out. Or, either way. Most likely it's going to point that way. So it's going to rotate oftentimes this way, whereas with the big toe it might go the opposite. So the actual big toe nail is going to start rotating that way. So you see as I move my finger, that nail is going to become less apparent from a top angle view. And as a result, what happens is that now there is tightness oftentimes along the outside of these toes in the tissues. It's causing the bones to be affected and then the toe to be rotated outwards. And today we want to talk about the rotational release, which helps to basically realign those toes over time. Now it does take a little bit of time to work on this. There's a pressure release you can use, and you can also use a rotational release. So oftentimes what you'll notice is that as you move the toe, like even in my case, you can see the toe is much more flexible when I rotate it out than when I try to rotate it in. So as a result, what's happening here is that there's tension in and around here that's causing potentially some outward rotation off the toe, especially in this case the pinky toe. And what you want to do is you want to basically take a hold of the toe. Make sure you hold the joint down so that it doesn't move around too much. You want to rotate the toe in the opposite direction of where it wants to go, which is going to create some pulling sensation on the outside of your toe right here. And then you want to move your knee side to side 10 times to basically release some of the tension within the tissue that surrounds this toe. You can also then work on releasing some of the tensions by using your fingers. And you can basically take the fingers and squeeze them from side to side, so from the opposite sides. So you want to squeeze the fingers into the tissues. You'll feel some tenderness in certain areas potentially. And then again, as you're finding a tender spot, you then want to move your knee side to side 10 times to release tension within that toe. Now, if you have any questions regarding the rotational release, please don't hesitate to post your questions below. Have a phenomenal day.